Good day, class. In this video, we are going to introduce hypersomnia. Hypersomnia is a condition when someone needs excessive sleeping. Very commonly, this is due to the medical conditions, especially the severe medical conditions that are related to the brain injury. This situation sometimes is quite a dark sign of the health. Patient may pass away in a very short period, but in the milder situation, before it develops into this stage, patient may present as tired, fatigue. They would like to sleep more. In this situation, what can we do for acupuncture? So, if not due to the injury of the brain from the hypersomnia, someone presents as sleeping a lot and fatigue, we can focus on the treatment of spleen and kidney. Because in this situation, especially the fatigue, we will think about the dampness. So our treatments will focus on the dampness, but in the meantime, we're going to identify into excess and deficiency. The symptoms may be excessive sleeping, fatigue, dizziness, headache, poor memory. As you can see here, all these symptoms, and when you see the symptoms, we still describe it as fatigue, dizziness, headache, which means these are not the typical hypersomnia, especially not the one due to brain injury or the final phase of human life. Patients still physically active. That's how the patient can tell you fatigue, dizziness, or headache. The symptom differentiation. Dampness in the spleen. The dampness will affect the function of the spleen, may result in qi deficiency. So dampness, the patient may present as fatigue. And in the meantime, if accompanied by qi deficiency, the patient may present as reluctance to talk. So these are the qi deficiency. For dampness, we must find evidence for dampness, such as swollen tongue, slippery coating, but in the meantime, the patient may present as for some symptoms that are related to qi deficiency or spleen deficiency. Heaviness sensation, that's dampness. Teeth mark, it can be the spleen deficiency and can be dampness. Damp heat, nausea, yellow coating. It can be greasy or it must be greasy because for slippery, you won't see the color. So it must be yellow, greasy coating. Patients who need excessive sleeping or fatigue. In this situation, we will consider as qi deficiency. The blood deficiency, the qi and blood deficiency, especially after long term, it also may result in blood deficiency. This will due to the relationship between the qi and blood. So in our treatments, we will focus on qi and blood. For qi deficiency, the patient also may present as heavy sensation. That's due to dampness. As you can see from here, all these symptoms, they overlap each other. Although we use one title, because these are the dominant, we focus on these aspects, but also may accompany it with the other pathogens. Patients may present as blood deficiency, such as pale lips, pale tongue, dream disturbed sleeping. This is also due to the blood, the nature of the blood is in, so that's blood deficiency. kidney axons deficiency, excessive sleeping, poor memory, weakness in the waist and knees. The treatment principles begin to harmonize yin and yang, clearing the mind. After the study till now, we will understand that in the treatment principles, whenever a patient presents as heat, no matter excessive heat or deficiency heat, we will not select Moxibustion. That's why damp heat in gallbladder, we use acupuncture without Moxibustion. We reduce the manipulation approach. Dampness in the spleen, qi and blood deficiency, kidney axons. These are especially the dampness in the spleen. This is the combination of excess and deficiency. So we can use a combination of acupuncture and Moxibustion because dampness is a kind of the nature of dampness is cold. It's in, so we can use Moxibustion to increase the heat. Moxibustion also can tonify, can strengthen the yang qi of the body. The blood deficiency, we can tonify the blood, we can enhance the function of the blood, but in the meantime, we also can strengthen the qi. Because the qi is the commander of the blood. Qi also the source of the blood. So when we discuss where does the blood come from, we say that the middle jiao receives the qi, and then the qi after the process of the middle jiao, which is the spleen and stomach, it will be transferred to the heart, to the upper jiao. Some of them will be transformed into red color, that's blood. So for blood deficiency, apart from tonifying the blood, you're also going to tonify the qi. That's why the treatment principles will be similar. Acupuncture and Moxibustion reinforcing. The points we can use focus on dual meridian. The reason is because the oversleeping, hypersomnia, patient feel fatigue, sleepy. When we consider from the phenomenon from yin and yang, sleeping is in, the patient doesn't want to move. So in this situation, we will consider that there is a lack of yang in the body. That's why we will focus on dual meridian. Dual meridian is the C of the yang meridians. You can see that's 220, actual HN1, HN3, stomach 40 for the phlegm and dampness, stomach 36 to strengthen the qi, the spleen and stomach. Dampness, bladder 20, spleen 6. Damp heat, bladder 19, due 9. Due 9, the Chinese name, 至阳. This term also very special. 至阳, 至 means extreme yang, yang qi. So which means this point has extremely yang qi. That's why we try to use the yang qi of the dual meridian to help to relieve the heat. 至阳. Qi and blood deficiency. Deficiency, we can use the Ren meridian, Ren 6, blood 15 and 20. 脾腧, 心腧, specifically related to the spleen and the heart, where the qi and blood come from. The transformation of qi into blood need the functions of the heart. The source of qi, that's from the spleen. So blood 20 and 15. Kidney axons deficiency, we can use Ren 4, blood 23. The actual points, HN1, needling point towards 220. Other treatment techniques: skin needling technique and auricular acupuncture. Auricular acupuncture, although we use the filiform needles to keep for 30 minutes, you also can use the seeds. So all the auricular acupuncture that we have mentioned here, all of them you can either use filiform needles or the seeds. Treatment from acupuncture in this situation. We can use the acupuncture to treat this situation according to the theory, but it is also very important to exclude the cause, such as depression. Patient also may present as, some of them also may present as hypersomnia, fatigue. Dementia is a syndrome that describes the deterioration in memory, thinking, behavior, and the ability to perform everyday activities. It is very common today. Around 50 million people have dementia. Although dementia mainly affects older people, it is not a normal part of aging. Dementia is one of the major causes of disability and dependency among senior people worldwide. Dementia has a physical, psychological, social, economical impact, not only on people with dementia, but also on their carers, families, and society. The syndrome differentiation, because this problem mostly affects in senior patients. So senior patients, the old age, mostly the deficiency, liver and kidney deficiency, or qi and blood deficiency. You also may accompany with the excess pathogens such as phlegm or bladder-stasis. So these symptoms we're not going to go through one by one. You need to try to explain from the theory each single symptom. The treatment principles to tonify the kidney, tonify the qi and blood. The points you can use: U20, actual HM1, kidney 3, kidney 4, gallbladder 39, stomach 36. Focus on the kidney, liver, and qi and blood from spleen. U20 is the local points, but U20 also on top of the body is the connecting of the meridians by Hui. By means hundreds, Hui means meeting. Hundreds of meridians, qi and blood, they meet at this point. They try to activate the circulation. For specific syndrome, you also can add specific points. Liver and kidney, bladder 18, liver 疏, 肝疏. Spleen 6, qi and blood deficiency, room 6, bladder 17. Phlegm, stomach 40, room 12. Bladder-stasis. Activate the blood. Bladder 17. This point we have mentioned quite a few times. Bladder 40. Needle technique for HN1, similar to hypersomnia. Needle towards U20. Other treatments: the scalp needle technique and auricular acupuncture. These are also some other techniques that you can consider. Although we have studied acupuncture treatments for dementia, but I have to say this disease is quite difficult, no matter from conventional medicine or from acupuncture. It is also very important to find the possible cause, although sometimes it is very difficult to find. But if we can, it is also very important to find the possible causes, relieving the symptoms, but in the meantime, we need to treat the root causes. In this video, we mainly discuss two diseases, the hypersomnia and dementia. For insomnia, hypersomnia, and dementia, these three diseases, these are all related to the mind. So our treatments, we will focus on the heart. The location of the disease is the heart, and it may accompany it with other organs, such as the liver, the spleen, and kidney. Thank you for your attention.